A leading kidney consultant at a Birmingham hospital is calling for a new practice to be introduced to help boost organ donation amongst ethnic minority groups.
There are just over 4,000 transplants in the country per year. Figures show that only just over 4% of organ donors are from ethnic minorities. There are currently over 7,000 patients waiting for a transplant. Patients from ethnic minorities will wait on average a year longer for a transplant. Well, with us now is Dr. Adnan Sharif from the Queen Elizabeth Hospital, who said in the British Medical Journal that priority for a transplant should be given to patients who are already on the organ donor register. Good evening to you, Dr. Sharif. Why have you said that then?
Well, there's a paradox between the number of people who are happy to donate organs and the number of people who will be happy to receive organs, which inevitably would be the entire population. And trying to bridge that divide, I think, is a crucial thing for us to do.
Yeah, is it a bit of a losing battle in terms of numbers at the moment?
It is, and we've got nearly just under 20 million people on the register. But I'm sure if you were to ask the majority of people, would you be happy to receive either an organ transplant or a stem cell transplant, the majority of people would say yes. So there's a large proportion of the population who are happy to receive, but not happy to donate.
Yeah, but what you're saying is going to cause controversy, isn't it? Because of cultural and religious beliefs, I suppose.
I accept it's controversial and there is a radical change, but just because it's radical, that doesn't necessarily make it wrong. I mean, I think a priority scheme is, in my eyes, the fairest system that we can possibly have. I think you have a number of people who've shown a commitment to organ donation and stem cell donation, and there should be some recognition for that in a system, and a priority scheme, I think, is that system.
And just to explain it, it's essentially the biggest problem is with ethnic minorities, isn't it?
I mean, it's a problem across all communities, but certainly we know that ethnic minorities are overrepresented on waiting lists for transplantation, and they are underrepresented as donors. So yes, there are specific religious, cultural, social issues for those communities which we're trying to address, but certainly this is a problem across all communities and the entire public.
Yeah, and this idea of a priority list, as it were, that does happen in other countries, doesn't it?
It does. So Israel, for example, has introduced a similar system, and the initial results are that there's been an upstroke in the number of donations, both while alive and dead, and importantly consent as well. And I think that's another important factor that we need to approach, family consent.
Yeah, I mean, we have had quite a lot of comments this afternoon on our Facebook site, loads in fact. I mean, one here is a lady called Maureen. I'm already registered, but I wouldn't be too happy if someone I loved was precluded from having life-saving treatment. You can see people feeling quite emotionally.
Yeah, I mean, I can see that understanding, and certainly nobody would be precluded. And what I would suggest is that if someone has a medical need for that transplant, which is over and above somebody else, of course, they should get that transplant. But in the context of, say, kidney transplantation, where you have two individuals, both with an equal medical need for that transplant, if there is no other difference between the two, other than one of them has, say, perhaps previously donated a kidney to a loved one 30 years ago, and somebody else who's not even on the register, I would say the fairness is to give it to the person who has donated an organ.
Okay, Dr. Sharif, thanks very much indeed.
Thank you very much.
It's just gone 7:15. This is our top story tonight. Confidence rising.